We have very brief closing remarks. I'll now like to welcome my sidekick, the individual who has been involved in the Walter Gordon Symposium planning since day one, Rayon, Junior Fellow, to deliver closing remarks and help us recap some of the findings from the policy co-design session and to deliver some closing remarks. Thank you, and please join me in welcoming.
Hello, folks. I'm actually won't be recapping it. I will give that role to our very lovely moderators to do so. But I wanted to thank you all for staying here, especially those of you who have been here since the morning. That is, you guys are the real troopers. But to sort of have some knowledge sharing around the different sessions, and I hope have been very productive conversations. I'd like to call the moderators from each of the three breakout rooms, starting with housing and James Lawtons. What did you discuss in 2 minutes?
2 minutes. So, in 2 minutes or less, I'm so not used to having a mic, essentially we discussed about where we thought the various elements of housing were intertwined, where there might be issues. Is it more of an economic issue? Is it more of a cultural issue? How do we look at housing, say, as a social marker of being in the middle class, or how does it affect our perception of ourselves? And also, how do we look at housing as a bedrock for other outcomes? How do we look at it from a health perspective? How do we look at it from a social developmental perspective? How do we really work with it as this multifaceted issue as opposed to it being housing affordability on its own? And it was incredibly important looking at other issues intertwined with it, such as the tenant board, redefining it and improving it to make sure it is more equitable, to make sure it is easier to launch appeals, while also looking at municipal burden through developer fees and how can we shift the burden of those to other areas to make it more, to incentivize more for development. And so we focused on all of that, and we focused as well on this idea of a stratification of our cities, of it being shifted into richer and poorer areas, as emblematic with grocery stores, where going to one grocery store you can buy something for $10, we're going to another you can buy the exact same thing for $1. And within that context, we looked at affordability through that lens, and how can we not only intertwine the cultural but the economic outcomes of affordable housing, and how can we move towards housing as a model of universality. Thank you all very much.
And for healthcare, we have Rajini Dorsant.
Okay, thank you. I will just share with you some of the things that we discussed. First, it was very important for the group discussion to discuss about some population that are affected by the healthcare crisis, and that should be taken into account when discussing about healthcare policy, like indigenous population and other racialized communities like Black communities. And also we discuss about how important it is to include gender minorities communities, seniors, especially seniors that are also part of the LGBT community plus, not only in this discussion, but also helping with discrimination when looking for health care. We also discuss about the importance of seeing people for who they are and their own experience with diseases as something very important, and not just the symptoms, and not just asking them about just to check boxes, but definitely asking them the way they feel, their experience with the diseases, so we can gather data and also open the door for more open discussion and give them the floor to really share what matters to them. And we also had a great discussion about the importance of data, qualitative data and quantitative data, and how both can be really helpful to tackle healthcare issue, especially the fact that a lot of data has been collected throughout the years with within the framework of a lot of research, but there's not a good bridge between those research teams and also where to look for those data that could help new researchers, but also that could help the system more globally. And we also thought about how should we integrate the university and more academic in the discussion about in the healthcare discussion, and we discuss about what are some of the barriers for academics to step out in the field and talk or share or help building framework or policies with confidence, something like fear of failing or the crisis of confidence. And we also touch on the fact that either in research, but also in real community where policy has to be made. It is very important to rely on connectors and translators from community to bridge gap between community's need and the decision makers, because this is something that is really important, and not just assume what people want and what people need, but actually go to them to collect those data and frame the policy around that. And last thing is that there was like a very nice ideas about how certain values from certain professions could be translated or could be studies to be translated to other set of profession, especially in healthcare, and how we could better study those models and having them integrated in the healthcare globally. And I would say the last thing, it was about the importance of follow-ups after events like this with reports, so discussions are not wasted. So that was mostly what we talk about. Thank you.
And lastly, Benjamin Robichaud for food security.
Rayanne, thank you very much, and thank you also to all those who met in the private dining room upstairs to have a varied and productive and enjoyable and insightful conversation in response to our food security topics today. We talked about a whole range of things. We talked about what we mean when we say someone has enough food. Is that they have enough of a particular amount, just enough calories, or does it have to do with having the right amount of nutritious food as well? It's not only amount of food, but also type that's available to people. We talked about the interconnectedness of nutrition, health, human health, and mental health as well. We talked about the ways in which food banks simultaneously fulfill kind of, of course, the immediate need to have something to eat, but also offer people a little bit more. People, in a situation where they're relying on food banks may be isolated, right, because of, all manner of reasons. And what this opportunity, the food bank, as it is, offers them beyond just the direct service, is also this capacity, this opportunity to reconnect, to form networks, to re-engage with other people, and to fulfill, that type of need in addition to the direct ones that the food banks are created to respond to. We also talked about, the degree to which there is, as people say, a sort of support cliff. So when someone exceeds this sort of threshold where we say people are able to get support, well, then what do? Their situation perhaps not meaningfully better than it was previously, and yet they are, beyond this threshold where they receive the kind of support that may continue helping them. Conversation turned to youth, and whether young people, have an interest in perhaps reinvigorating, revitalizing, the kind of support systems available here in Canada. We talked about Canada being a sort of historically, a kind of separate place from the rest of the world, at least in terms of attitude, and that is maybe a newfound kind of thing for Canada and Canadians to wrestle with in the contemporary moment. And we settled on a particular idea for kind of reimagining, as was described, within the conversation upstairs, reimagining the Canadian social contract, whereby instead of designate particular amounts of support to particular kind of populations, is instead reimagined as a sort of integrated effort, whereby Canada commits to a certain sort of a level of capability, for people within Canada, a certain level of quality of life that we commit to. And civic organizations, all levels of government, work in a collaborative way to ensure that conditions are in place in Canada to ensure this minimum level of adequate quality of life, whether that means adjusting levels of support in populations in real time, perhaps with a reinvigorated modern kind of data collection, more real-time data collection system. All of these strands of the conversation led to this idea in the end, and we talked about how such an idea is perhaps not only kind of desirable for academics who are thinking about the issue, but also for the many people beyond a room like this one, who want to see not only, food security for themselves, but want to exist in communities where this is the case, right? Where people do not have to worry about being hungry themselves or having to give up a meal in order to feed their children, so that life in Canada genuinely can be, as stable and as nice and as safe as we all want it to be in the end. And that was our conversation upstairs. Thanks so much, everybody.
It's totally okay if the recap just went over your head. It's been a very long day. But we do want to make a promise that today's findings will be shared through a report, because we hope that ongoing conversation and increased collaboration, not just the people who are with us today, but also those beyond. So we do make a promise that there will be a follow-up report synthesizing all three panels, as well as the co-design breakouts that happened today. Some thanks as we wrap up today's event. I want to thank Sarah Baum, Joe Costa, and the staff here at Massey College for their immense help. You see all these cameras and the events behind the scenes. We also want to remind you all that the Walter Gordon Symposium has been a beautiful collaboration between two longtime friends here at Massey College, as well as the Munk School of Global Affairs and Public Policy. So I want to extend a deep gratitude to the leadership behind the Walter Gordon Symposium, David Slowly, Tom Axworthy, and Carolyn Tui for your support. And of course, the junior fellows behind this who have been diligently planning this since September. Many, many meetings across lunch and dinner and breakfast and it all over again. So thank you, Arvin and Rajane and Ben and Reke and James and Renee and myself and everyone else for your time, and Della as well. And thank you all for being here and contributing so fully to the symposium. If you have not done so, please subscribe to Massey College as well as to the Munk School's newsletter for more conversations like these, and stay informed on many other events and conversations still to come. Thank you, safe travels, and we'll be having a small reception, so we would love for you to all to join us and keep the conversation going. Thank you, folks. Have a good one.